Yeah,
So,
thanks, Steve.
Thank you, Richie.
Thank you. Well, thank you for your long introduction, and makes me feel really old. And it's a real pleasure. Obviously, I feel blessed to have been able to mentor people like Steve, and I'm so proud to see how well he's doing it and killing it. And following Chris, who I was very lucky enough to work with 4 or 5 years ago, he ran an invasive program at St. Francis, and I had a chance to do that. And it's amazing to see him go on and just obviously skyrocket, as you know, internationally. I feel like he's, the guy from Miami, Mr. International. Who was that? Pitbull, yeah. So I didn't want to call him a pitbull because it may sound insulting to him, but I don't want to say that. But it's definitely a pleasure to be here. And actually, I'm happy that the CCI gave me a chance to come back. So last time I was here, I was given the opportunity to be a keynote speaker. And it was probably one of the challenging talks I've ever given. And they asked me if I do talk about ADA, American Disability Act. And I was like, I don't know much about that. So it was in Las Vegas. And about 15 minutes before I had to talk, there was a fire in the hotel. And it was blaringly loud, right, Jarrell? It was the loudest and I'm sitting there, I'm like, so what do I do? Chris Nelson's like, you talk. And I'm like, was it not the loudest thing you've ever heard in your life? And I'm like, well, let's talk about. So it was just really entertaining to be able to do that talk, which is a difficult talk, and to do that in front of educators, and it was just very, really interesting. So I feel happy to come back and at least had a chance to talk again where people can actually hear me talk, which is really a thing. But I also want to take a minute or two to thank and be once again, very thankful for all of you guys. First, I want to talk with CCI. So CCI is an absolute amazing organization. I've been involved with them for several years on their board of advisors, item writing, etc. I can't believe how many amazing professionals that I've met at the CCI. People have volunteered their time, expertise. Amazing. Absolutely amazing. And a lot of people talk about organizations about we really want to support educators, but CCI puts the money where their mouth is. By running this organization, running this meeting for the last, I think it's been a dozen years, I don't know exactly, but put money into it, have you guys come together to network, to listen to you guys, and to get information, to give you guys a chance, whether it's a new program, old program, et cetera, is amazing. So I really appreciate what CCI does, and like I said, I really want to just thank them for that. And I want to take a minute and say thank you to you guys, because I don't know, you may not get, or maybe you don't think you're appreciated, or what you do means. Maybe you don't hear thank you or we appreciate you as educators, because a lot of times students are just, you don't really hear that. But I don't know if you know the influence, the impact that you guys make. Talking about the end user, human beings. You are touching human beings, helping them, teaching them the new healthcare people in the future. So I didn't tell Chris this when I first came in, but my brother was diagnosed with some heart failure recently, one of my older brothers. And he's in Boston, and he ended up getting a mitral clip yesterday in Boston. And I knew I'm not going to say names of cardiologists and stuff, but I knew the cardiologist who was the imaging cardiologist at Beth Israel. And so I called earlier today because he had his clip put in, did really well. And so a couple of people visited him the next day, the team. So he was there, this doctor, and with 2 or 3 other people. And I guess he had mentioned that who I was in relation to my brother to some of the people at the staff there. And little did I know that one of the people was a cardiology fellow at Duke that's actually doing his interventional there. Then another gentleman says, you don't know me, doesn't make a difference, but I work in the cath lab. And I'm like, and so my brother's like, oh, nice to meet you. He says, I just want to let you know that I went to the school that Richie had in Connecticut, and Chris Steelman taught me. Thank you. I appreciate that. Okay, disclosures. The first couple, whatever. But I wanted to show you this part right here. This is not to show off or talk about it, but I just want to show you that I've been involved in some stuff, and many of these people in the room, Joy, other people, Michelle, I mean, a lot of people have been involved in this organizations, different organizations, and I just want you to know that we are here as a resource for you guys. Please do not be afraid to come up to me, ask me questions, ask any of these people here. We're here to help you, work with you, anything we can do. I've been involved in starting a couple of different schools recently. I get such joy in having other people start a school, have their students, graduate them. The more people, the more legacy, the more impact that I can have. Personally, what makes me excited about what I do. So I wanted to point that out to you. But we need to talk about the current landscape of the clinical sites. So there's a lot of things that's going on right now, right? Labor shortage, right? So when I did this talk, when thinking about this talk, I wanted to ask this, and I know I'm with educators, so I know you guys want to talk, right? So I'm going to interact with you after I talk a little bit of advice I can give you guys about clinical sites. But I'm going to ask you guys some questions also. Then I'm going to do 3 clinical scenarios where I want you guys to figure out what you would do in those clinical scenarios. So I want to make this a little interactive. But look at this, what we see here. This is the challenge, right? Obviously, Chris did an amazing job. He has clinical sites, basically the whole entire country and across the world. But in general, a lot of times there is difficulty getting our clinical sites, right? There's also a lack of structured supervised feedback in these clinical sites. We want to get diverse pathologies for all of our students, right? That can be a challenge, right? Not all hospitals provide the same clinical care, right? We want to obviously apply all of the stuff in the classroom to the clinical site, right? But we also have to be cognizant of basically students and their concerns. So what is the important thing? So you ever hear the saying, can't live with them, you can't live without them? Well, with the clinical sites, well, we can't live without them, but we actually have to live with them, right? So we need clinical sites. And it's so important because obviously we need this because we can't teach in the classroom. Yes, we have simulators, but it has to be the real world. We have to be in there. We have to have them see that kind of stuff. And it's very, very important because we want them to be professionals, and we have to have these clinical sites. So what about obtaining clinical sites? It can be a challenge, right? Obviously, first of all, I need to evaluate the level of a clinical site. Do they actually want to take students? So have you guys done that before? Have you gone to a clinical site and see, are you really interested? Have you had students in the past? What's your experience with students, right? Also, I get a chance by going to check out a new clinical site. I want to see what the atmosphere in the lab is. What's the breakdown of the lab? Do we have a lot of older sonographers, younger sonographers, right? I don't know, are you guys biased? Do you think only older sonographers, older educators, older people in the field are better teachers or younger? Raise your hand if you think older is much better. Yeah, so younger people, a lot of people think, well, I've only been out for a year or two. This happened to me at Duke. There was a bit of a turnover, and we have a lot of veteran people at Duke University in our lab. We have 54 sonographers at Duke. We have a lot of young sonographers, and the sonographer's like, I don't know if I could teach. I'm like, you don't understand. You guys are amazing young sonographers. You know way more than a student does. So don't underestimate your ability to teach. Younger people do a fantastic job. Younger people know what it's like to be a student, because they were obviously a student not that long ago. So use your connections, right? Talk to people. So if you work at, for example, like we were with where Chris is, he has a radiology program. So he may have established clinical sites through radiology, nursing, other places. So if you do work in a university, I would obviously tap into those clinical sites that you have already established. And that's really, really important. So you may have to sell your program. Have you had to do that? Raise your hand. Have you had to sell your program and say to them, hey, you know, there's a benefit to this. But you think about the landscape right now, the shortage is not good, right? So more people like, I have to do more work with less. For me to have a student again is going to be even harder. It's going to slow me down. So you really have to sell it. But you need to think about what's going to happen. If they get someone in that clinical site and they train them their way, they're going to want to hire them, right? It's great if you have a former student work there. They see the proof in the pudding, right? Meaning like that student went through the program, we love her. We would definitely take another student from their program, right? That's huge and key when it comes to the clinical site. So again, educational opportunities, right? You can provide, if I'm a sonographer, obviously echo teacher, so if you're an accredited program, you can provide 6 CMEs if you're in an accredited program. So that helps, right? If you need 10 a year, you're 60% there. So that can be helpful in that way too. So also, you know, if you're involved in education, those labs will keep up to date, which is important. Any of you guys have a story of a maybe success story of you getting a clinical site? Anyone want to share one? Shy? Educators are not shy. Yes? Oh.
I'm not shy.
You're not shy. Okay, Maria, I appreciate that. I will report back to Jeff and Don. Okay, very good. So I guess we'll go on. You know, to talk about stories. So we work in the medical field, and we talk about a cure, right? Hopefully there's a cure for everything. Obviously, there's not a cure for anything. So my mother, God bless her, she was an amazing person. I'm the youngest of 11 children. Can you imagine taking care of 11 children? And I was like somewhat a calm person, and I'm like a crazy person. So you can imagine how calm my mom was. But she always had sayings. She would go on and on about sayings. Have you ever heard the saying, an ounce of prevention is worth a pound of cure, right? So she would say that a lot to me, right? So this is my philosophy, and this is my goal to teach you guys something. I believe in cure. What is cure? It is this. So let's talk about it. Communication. This is where things go wrong a lot. There's a lack of communication on both sides. Something is going on clinically, or something is not being communicated. You need to find out how many times you have different clinical sites that say, I just want you to call me, or send me an email, send me a text, or what. There's different ways to communicate, right? So you have to find out what works best for that clinical site. But communication is very important, right? And we're going to talk about one of the clinical scenarios coming up about, you know, talking to students and communicating, verbal, nonverbal, whatever. We're going to talk a little bit about that in one of the clinical scenarios. It's really important. So understanding, very important. It's important that you, as a program director, clinical coordinator, whatever, understands what's going on the clinical site. Are you guys in the same understanding of what you're teaching, what the policies are, what your comps are, everything that's going on with the program? That's very, very important. And I find a lot of times that there's a miscommunication or there's a lack of understanding of what you're trying to get out of that clinical site, what you're teaching, etc. Very, very important. So I can't emphasize this enough. I do this with my students the first day. I go through the handbook. They see it ahead of time, and we have them sign, right? Sign off little sheets about all the little policies we have, but I will go through it again. It's very important. Ounce of prevention is worth a pound of cure. So going over this is really important. So there can't be any, no, I didn't understand that I was supposed to do this. I didn't understand, no. I know you say, well, it seems like they can read, why do I need to do that? No, you need to sometimes spell it out, and they totally understand that. So respect and responsibility. I feel that you should respect both the clinical instructor and the student. There should be a mutual respect. What are we trying to do? We're trying to create professionals in the future. In the clinical site, they learn this, right? So we want that respect to be there. Respect for the patients, everything like that. Respect and responsibilities. What is your responsibility at the clinical site? I think it's important that we do, for example, at Duke, we have a rotation where we have one of the sonographers teach what they do in different areas of the hospital. Like if you're in North versus the outpatient clinic, they go through and tell them, here's where the linen is, here's where the supplies are, here's where this is. So there's not like a confusion like, do you want me to prep the rooms? Yes, you're gonna prep the room when you come in at 7:45, you're gonna get the rooms ready, etc. They spell it out. That's your responsibility. So explain that, very, very important. Expectations, oh my God. This is where it happens a lot. What do you expect of the students, right? What do you expect of the clinical site? It has to work both ways. You have to communicate, there has to be understanding, there has to be the responsibility to know what those expectations are. Very, very important. Explain them. What do you expect your student in the classroom or in the clinical, what do you expect them to do? And again, the clinical site really needs to explain that to them. Very important. Okay, so let's get into some talking and get you guys talking a little bit. So here's clinical scenario number 1. I told you so. Program director, coordinator goes to visit a site halfway through the program. Clinical instructor says, that student isn't doing well, and I don't think they're going to get a job in the future. So I'm like, you'll probably, could you give me some specifics, right? Because you can't just like make a general statement like, not so good. Like, okay. Well, the student isn't engaging with the staff and not showing interest in learning. Okay, again, I'm going to ask, could you give me more specifics? Okay, I'll tell you. After the exam is over, the student will sit in the corner and start to study and doesn't review the case while the instructor is putting in the preliminary results. What do you think? What's the cure to this? Anybody? If you and that, go ahead.
Well, I think the student needs to know what her expectations are, or the student saying.
So it could be expectations, absolutely. Go ahead.
The first thing I do is, once I gather the data, is I said, have you talked to the student?
Yep. So communication is important. Expectations is important, right? So I believe communication, expectation. Did you actually, you guys are so good, aren't you? Are you like educators or something? Have you done this before? Did you see my slides? You're just wicked smart, right? So there's my Boston accent, sorry, it came out a little bit. So I say y'all a lot now in the South. Okay, so yeah, did you actually communicate that to the student? Does the student understand the expectation? So what do? Why don't I find out what the student thinks? Interesting. I talked to the student. This is what the student said. The lead sonographer, when they first got there, said, you will receive your clinical hands-on, but when the exam is over, that they don't want you to bother the instructor while they're putting in the prelims. Leave them alone so they can concentrate and do their work. So the student heard that, right? So obviously, after talking to the student, saying this was told by the lead person that they was not to do that, they were like, oh, there's definitely a miscommunication. And interesting enough, 5 months later, what did they do? They hired that person. That person's been working there for 15 years. So isn't it funny how like this person will never get a job, loser, doesn't know what he's doing, but he was following what they told him to do initially. You kept on perceiving that this person wasn't interested. No, they're like, oh, I would love to actually put the prelims in. I'd love to talk to them, but I was told not to bother them. So there was an expectation and communication that went wrong. Does that make sense? Good. Next scenario. Nobody's perfect. I'm not going to sing Miley Cyrus, don't worry. So nobody's perfect. Program director goes out and visits the clinical site. Clinical says, this new student is rotating through, isn't doing well. I hate these general statements. You guys get this sometimes? I want to jump out a window. It's like, okay, so, hello, could you give me some specifics? Like why do you think this student is struggling? Are they struggling? I don't know. Well, their skills are way behind. Okay.
You think I'm stealing your slides?
What's that?
Are you stealing my life? Yeah.
Your life? Okay. I didn't know this is your life. I apologize, but this is real world though, right? Okay, good. I'm glad this is resonating a little bit because I don't want to be like, this never happens to me. So, again, ask questions because I hate generalities, right? She's way behind. Because I want to know what part of the skill set is she missing. It could be in the cath lab, it could be working with catheters, it could be this, it could be that, it could be echo, couldn't get views, vascular, et cetera, going on. So why do you think that? Why do you think she's behind? He or she's behind, excuse me. They're not as good as the last student. Have you ever had that? So what do you think this is? There's got to be a cure for this maybe, right? I mean, has it ever happened, you guys? Have you heard this before? It doesn't drive you crazy that they compare students? And it's a reality. They do compare students, yes? I don't think it's fair, though, because some people learn skills, could be physical skills, whatever, earlier, later, and as they rotate through, they're getting more experience. So, I mean, the last student could have been in their 4th or 5th month, and they're coming through the 7th and 8th month, so you would think the skill set's different, right? Obviously. So what is the cure for this? If I pushed a button. So don't compare students. So you have to educate the clinical sites. Everybody's a little bit different, right? All students learn at different speeds. And do you remember what it was like to be a student? It's important. So it's interesting because when I first started at Duke, and my program is very unique, and we throw students into clinical after 5 weeks. We just throw them out there. It's my philosophy because as much as you can think about reading a book and doing, I mean, you need to be in the labs, working, seeing stuff. So Duke had usually had students from Spokane and other places, second-year students who've already been scanning for a while. They're like, wow, these students are super green. So right away, I had this like first couple of months, they're not like the other students that we get from other programs. I'm like, that's correct, but you will see by the end of the year when they've had 4 days a week, over 50 weeks, how good they are. And they realize at the end of it, yeah, it's a good program. More hands-on is a really good thing. So it's interesting how they do that in that comparison. Okay, next one. It's how you said it. It's how you said it. How you said it. Student calls me crying upset. What happened? My clinical instructor said I will never get a job because I didn't know a question he asked about EKGs. So I'm like, uh-oh. What was the question? Well, the student was asked what EKG finding is in cardiac tamponade. I wasn't exactly sure, the student said, because there could be many EKG findings, obviously, in cardiac tamponade. Because she had studied, obviously, there could be consequences why someone may have cardiac tamponade, right? Could be an MI, it could be tachycardia from cardiac tamponade, etc. And he wanted a specific answer. I didn't know it, so I didn't know what to say. I didn't say anything. He made me feel stupid. He assumed I didn't know what I was doing. And I'll never get a job. So really upset. Student didn't want to go back to that clinical site. So I had to talk to the clinical instructor. I'm sorry, what's the cure for this? Keep on going back to what's the cure. Education is, I thought I heard that, I'm sorry. Communication to the instructor. So how would you deal with that? I'm just curious because I have a few more minutes. How would you deal with that instructor? Because sometimes instructors don't want to be told anything, do they? And I'm teaching a student, I'll teach him the way I want to teach him, right? But I'm right? I don't know if I'm pushing my, yes, no, maybe? Anybody want to offer? What would you say, young lady? She's like, why are you putting me in the spot? I just moved from the back to the front. I'm going to move back to the back again, yeah.
Just try to explain to them what you're explaining to the student about it.
Yeah. Do you think that was a good question to ask? Or do you think it was kind of, it wasn't specific? Okay, really good, excellent job, ready? So, I talked to the instructor. I said, well, what exactly was the question that you were wanting to ask? Or what was the learning objective you had in mind? Like, what did you really want to know from that student? Not a general question, right? And she said, well, I wanted them to know if they knew about electrical alterans. Okay, like why didn't you just ask them a specific question, right? So I said to him, telling him like, yeah, there's definitely a few EKG findings, right? So again, with cardiac tamponade, electrical alterans, yes, can be seen with a large pericardial effusion with swinging heart. It doesn't mean that the person definitely has cardiac tamponade. It's a clinical diagnosis. We know that, right? So, but it's interesting that, why don't you ask a specific question and not turn around and tell that student that they don't know anything, they're not too bright, they're stupid. He didn't say they were stupid, that it made them feel that way, right? And these students can be very, obviously sensitive because they do want to get jobs, right? And they want to perform well. They don't want to look like they don't know what they're doing, right? So to me, this is a learning opportunity, right? Teaching that instructor that, what you say, the meaning of what you say, or you ask questions, you should be somewhat specific in that. Because a lot of times we do that as teachers, right? I don't know if you guys have a question in the back of your mind, you want an answer, and you say a question, you look at your students, and they're like looking at you, and they're like, could you be specific? Because my students do that a lot, because I make general questions, and they're like, well, what do you want exactly? So then I have to retool that question. So I think it's really important. But this is what's important, though, when it comes to constructive or delivering a message, right? Communication is really important. So to me, students definitely want to be challenged. And I love challenging my students. I'm a flipped classroom person. I come in and I ask them questions, because the only way I can find out how much a student knows by asking them a question. And believe me, and Steve and those guys know, I will repeat myself 1,000 times to have someone learn something. But if they're just quiet, so I tell them, even during my interviews, I'm like, how do you feel like being put on the spot? Because I put people on the spot, and I go around the classroom with questions all the time, because I want to make sure they know what they're doing. I realize that if they don't know it, I will take the time. I won't say to them, why don't you know that? You should know that. I'll say, you know what, let's go over that. Let's explain it. It's a teachable moment. I want to make sure that I'm resonating the information to my students. So it's important that you want to know the desktop and whether there's a breakout session at 4:10 versus Richie Palmer's talk versus, I don't know, or whatever. I don't know if you see that in the computer by that, sir. Whatever, no big deal. But students want feedback, right? They do. They want to know how they're doing, right? And to me, there are different learners, and sometimes you may have to work on different learners as far as what they understand. And this is where developing different strategies. And Chris did an amazing job talking about the variety of educational things that people learn in different ways, whether it be a higher level, lower level. We do case studies a couple times a year. It really makes them apply a pathology to actually verbally collecting data, showing a talk. That shows a higher level of education. So they like to be challenged. They like to know what's going on. So with the last few minutes, so maybe you may have a clinical scenario you may want to talk about. Do you have a scenario that may come up that we could maybe have a cure for? Anybody have a situation lately? Young lady?
What is your suggestion for our clinical sites are not very thrilled about having students. They need the students for surrounding, but they don't have time or they just really aren't good with our students.
Yeah, so that's a way to evaluate that clinical site. So your question is, they're not thrilled of having a clinical site. So the question is, this is not going to be, you like this answer, but that may not be a good clinical site for your student. So I'm an advocate for my students too. I want them to have a good clinical site. So follow up, go ahead.
It's our only, we have a group take over all the hospitals.
Oh.
Only section.
So they're forced to take a student.
They're forced to take.
Yeah. So that's a challenge, right? And the question is, go ahead. Is it staff or management? Staff. Yeah, because the management isn't doing the work. Unless the management says you're slowing down and not being productive, that might be a management issue. But it's mostly probably the staff that's like, hey, I'm busy, I don't want the extra work. And probably the answer is, I'm not getting paid any more money for this, am I? Right. And that's another clinical question, right? So it's never fun to be forced to have a clinical site put upon you. So I know you're going to hear this, put a lipstick on a pig, but you may have to say to them show the value in that. And maybe, is it early on? Has this been a couple of years now? It's what? No, because I was hoping you might say it's new, because to me, if it wasn't new, and say you get a couple success stories, a couple of students that did really well, and say they hired them, then they might say, you know what? I see a value in this. being a clinical site because we hired Steve and Jory and Chris and Michelle, and so that was an amazing thing that we did. Maybe you see some value in it, you know? Or maybe, like I said, you could do stuff where appreciation stuff, like Chris was saying, like, you know, make a flyer saying, clinical instructor of the month, and, you know, make them feel like they're involved or something. You may have to like butter them up a little bit, but I'm sure no one likes to be forced to be an instructor, and so I don't know if that's a good answer. Is it? It's not a very good answer, is it? I hope I didn't answer that. Yes. Oh, go ahead.
I was just going to say that's a really good person to put on your PAC committee. If they have so much insight and they really don't want to be invested in your program, making them invested if they'll be in your PAC committee is a great way to get the buy-in.
And you say PAC meeting?
Correct. PAC meeting. So program, thank you.
Yeah,
Advisor.
just so people doesn't know the initials, so. Yeah, so super user-friendly people, yeah. Super user-friendly people, yeah. Unfortunately, there's not a cure for all diseases. Thank you, Richie, for coming and teaching me nothing about my situation. You have been so valuable to me, and I can't wait not to come next year. Oh, is there another question?
So I am the program director at a relatively small school. We're not connected to a university or anything.
Excellent.
We're a private school. We ran into a clinic site who will not accept students because we cannot compensate monetarily. We do offer CMEs, but we are a small school. So how would we kind of handle that? And I'm also curious how many people actually are able to pay their clinical.
Yeah, so their expectation is that they want money for this. So, Steve, do you pay your clinical sites?
Yeah, so we do pay a stipend, and I followed the model from which so they get $2,000 a year, which we break up twice throughout the year for a full-time student. Because like Richie mentioned, for a majority of the year, they're at clinical 32 hours a week. So that is, some places may not even see it because it goes to the wrong place. So we hand them a check.
So at least they see it. Like they may not get it, but they can use it to buy books, maybe attend the ASC.
Education.
So. Yep. And what happens to that money afterwards is a great question, because I'm sure that goes to the administrator and that goes like, thank you, that money comes to us, but we show them that we are throwing them. So when they go and say, hey, I'd like to use, I know there's $2,000 coming in from that school, can I utilize that for a trip or something? Pat?
So I've been thinking about your conundrum here for a bit, and the thing that I would do is I would put it back on the individuals who are speaking about it. So if somebody says we don't like to have students, I would have a sit down and have a conversation with that individual and ask them what about having students is difficult,
Right.
and have them verbalize it. Because once they start to verbalizing it, all of a sudden they start to realize what they sound like. And so I would say, what is it about having students you don't like? Well, they slow me down. How are they slowing you down? Right. What can I do to assist that not to happen? So once you start to say, I'm willing to make some changes in my training of them, if you can provide me specific examples of how they are slowing you down, I will do that. But all of a sudden, oftentimes they can't. And then you just start, then you push them a little bit harder. So what is the issue? Why don't you want to have the student here? What is the underlying issue that the frustration that you are feeling?
Yeah.
And so you get them to verbalize precisely what it is that the problem is. Because oftentimes people will refuse something because of an underlying issue that they don't want to verbalize.
Right.
And so the key to solving these problems is to get the unsaid said.
Right.
And once the unsaid is said, then you can start to have an open and honest discussion about what really is the issue and find a collaborative problem. But get them to say the unsaid part. That's
That's
part of
a
the
general
negotiation.
statement. That's a general statement. I don't like working with students. Well, tell me specifically what you don't like about it. And maybe, like I said, maybe it's a scheduling problem. Like maybe you can do every other patient you could, have them. Or maybe you can just teach that person once a week. Have a strategy. Go ahead, Maria. Yes?
Michelle, you asked that question, right, about the
Yeah.
stipend? So we pay a stipend. I mean, I come from Massachusetts College of Pharmacy and Health Sciences. So, I mean, everybody needs a rotation, right?
Yeah.
So the school pays stipends. The issue is, like Richie said, some of the echo departments don't see it, right? So when I develop the relationship, I probably shouldn't say this out loud. They're supposed to pay according to what's in the clinical affiliation agreement. When I develop the relationship, I tell them I'd like to see the money go to your department. And so in behind the scenes, they will work on it to get like a budget code that goes on the check. And then sometimes it doesn't happen. So something, I don't know how this happened last year, but it wasn't, I talked about it with the, there's a director of, clinical affiliations. So some hospitals, they don't see a penny. So then I created a letter, but I got permission saying this is what some hospitals do, right? So then it changed some of the hospitals, so at least the department's got some of the money. I just told them what scenarios are. So it might help. That's all. I just want to tell you.
Spell it out a little bit, whatever. I mean, it makes sense, right? I mean, that is a frustration we do hear a lot, right? See, we hear that, we don't see those money, it's not going to my pocket, we hear that all the time, but at least we let them know, and like Steve said, I would actually hand them the check, like, look, 2,000.
Yeah. Do it during a site
so
visit.
we're not lying to you, it's not like, what's the checks in the mail, right? So young lady, yeah.
I'd like to give it in a different perspective.
Oh.
So if it's paying
I knew the educators would not talk. I was really nervous about them not talking, so,
paying a clinic site is super intriguing,
yeah.
right? But I would like to,
For that organization, how many job postings do you have listed for this difficult to fill position? Most likely, they probably have about 4 or 5. And let's start there, because I'm offering you a pipeline to that.
Yeah.
And an opportunity to first access to these students and maybe make an impression so you can fill these difficult to fill positions. Now, what I've seen other clinic sites do is like if they're on structural heart team or whatever, they might give $1 stipend. Or why are you not doing your staff how you do a new hire, an orientee? You do 40 hours of training, you give 2 hours or 6 hours of PTO, things like that. Those were ideas I presented to the clinical sites, but I would start with, how many positions do you have again? And kind of go from there.
Before Pat says something, what's interesting, I remember at my hospital back in Connecticut, we had radiation therapy people in part of a school. Our hospital paid the school $10,000 to take a student because of the need that was there. So it's funny how you talk about the site wants money. The site should actually probably be paying you for the future jobs. I know I'm running over. Pat, do you have a quick message?
Well,
I don't want to keep my person
that's
money
good.
late because
just a
she
very-
will literally kick me in the head. So.
Just very quickly, one thing that I was able to do, we had a hospital that did the same thing. They said, we don't want to take a student because you're not paying for us. And I actually had somebody, one of our MBAs, come up with a file that said, when you onboard somebody, there's 3 months where you pay them and they don't know anything. We're giving you a year of training a student to the exact same thing. You're paying them nothing. They come out, they can immediately take call without a 3-month pay period where you're locked in and paying a salary that you can't use. So in the long run, we are saving you, and I forgot how many, it was like $30,000, $40,000 that we were saving them in free training.
Yeah. So my last slide, I had to pay homage to one of my friends and mentors, Dennis Carney. And I remember him saying this to me about being a teacher. He says, Richie, don't call me a teacher. I'm a facilitator of learning. And I was like, thought about that. He goes, because you think about your student, you're teaching them, but it's going to be a lifelong learning in our profession. Our profession's growing all the time. So I love this, and I use this all the time. What do you do for a living? I'm a facilitator of learning. So I just wanted to put that little note, and I love Dennis, and he's amazing, and obviously been involved with CCI, and I wish him well, and thank you very much for your time.